Tonight at 5:30, in just 3 days, CCS Oncology, the troubled cancer treatment provider, will be closing its doors.
Now, since CCS made the announcement last week to shut down, other providers have said that they've seen a surge in additional patients in need of help. And tonight, Channel 2's Jeff Preval looks at the challenges patients and providers are facing.
With CCS Oncology closing its doors on Friday, other cancer treatment providers in Western New York have become the safety net for patients in need of help.
I mean, this is a very unique situation. This is something that, hopefully doesn't happen except in extraordinary circumstances.
CCS has sent out urgent notices to patients saying it's closing because it's bankrupt. CCS filed for Chapter 11 earlier this month, just days after the FBI raided CCS offices. The feds have a Medicare fraud investigation into CCS. At Roswell Park, they're seeing former CCS patients.
In the end of last week and the first couple of days of this week, we've seen a very significant increase in the number of patients.
Roswell says while it's able to take on new patients, there are challenges.
When patients are transitioning their care mid-treatment, it's brought up a lot of issues that we've identified. Number one is getting their medical records. If they're in the middle of treatment, especially something like radiation, we need to know what their treatment plan was.
At Buffalo Medical Group's Williamsville location, Saturday hours are being offered as it takes on former CCS patients.
We're probably seeing as much as 2 to 5 to 10 a day.
How quickly until they can get maybe their first appointment?
If it's non-emergent, within 2 weeks. If it's emergent, we can get them in usually within a few days. The issues really become more so with radiation because each radiation machine is its own device. So when patients come over who are in the middle of radiation therapy, they need to be re-simulated on a different machine. So that's a little bit more of a cumbersome procedure. We'll find space without any difficulty whatsoever.
And there's definitely a personal impact for patients who are in the middle of this transition. The providers I've talked to say that former CCS patients have gone to them upset, anxious, and with a lot of questions. Now, Roswell Park held a community forum last night for former CCS patients, and I'm told that Roswell registered about 20 new patients last night, Scott.
All right, so what about insurance coverage? Are the patients still covered during that transition period? I know that can sometimes be very sticky and very concerning for a lot of patients.
Yeah, absolutely. And obviously with insurance, things do differ from patient to patient. Now, the chief medical officer at Roswell told me that they are having good luck with local insurers continuing coverage, but that they're having some challenges with national providers that are unaware of the problems at CCS and getting those insurers to understand the urgency of this situation. Scott, from what I'm told from Roswell, that's the situation they're finding themselves in. Those negotiations and talks still continue.
All right, Jeff Preval tonight. Jeff, thank you.
You're welcome.
Appreciate it.
Yep.